Leopold's maneuver are a systemic method of observation and palpation to determine fetal presentation, position, lie, and attitude. It is preferably performed after 24 weeks gestation when fetal outline can be palpated. Perform hand hygiene to deter the spread of microorganisms. Good morning, Miss. I am Rose Garcia, your student first for today, and may I know your name, please?
Jacqueline.
So, Mrs. Jacqueline, for today, I'm gonna perform the Leopold's maneuver to determine the position of your baby. Explanation reduces anxiety and enhances patient's cooperation. So, would you like to go to the restroom first before we start the procedure so that it won't be uncomfortable for you during palpation? Emptying the bladder will promote comfort and allows for more productive palpation because the fetal contour will not be obscured by a distended bladder. Position the woman supine with knees slightly flexed to relax the abdominal muscles. Then place a roll towel under one side to tilt off the uterus of the vena cava, thus preventing supine hypotension syndrome. Expose the abdominal area and drape the patient to maintain privacy. Warm hands first by rubbing them together before placing them over the woman's abdomen. Warm hands provides more comfort for the patient, and cold hands may stimulate uterine contractions. Observe woman's abdomen for longest diameter and where fetal movement is apparent. First maneuver. Stand at the foot of the client, facing the client, using both hands. Feel the fetal part lie in the fundus and palpate the superior surface of the fundus. Determine the consistency, shape, and mobility. First maneuver is done to determine what position of the fetus lies in the fundus. Second maneuver. Face the client and place the palms of your hands on both sides of the abdomen. Palpate the sides of the uterus. With left palm stationary on the left side of the abdomen to steady the uterus, the right palpates the right side of the uterus in a circular motion from the top to lower segment of the uterus, applying gentle but deep pressure to palpate the fetal outline and small fetal parts. Second maneuver is done to determine which direction the fetal head is facing. Third maneuver. Gently grasp the lower portion of the abdomen just above the symphysis pubis between the thumb and index finger and try to press the thumb and your index finger together. Third maneuver determines the presenting part and its mobility. If the presenting part moves upward so an examiner's hands can be pressed together, the presenting part is engaged. Fourth maneuver. Face the feet of the client. Place one hand each on either side of the lower pole of the uterus. Palpate the fetal head by pressing downward about 2 inches above the inguinal ligament by using both hands. Fourth maneuver was done to determine fetal attitude and degree of fetal extension into the pelvis. This should be done only if the fetus is in cephalic presentation. Place your client in a comfortable position to ensure safety and comfort of the client. Document procedure and assessment findings and the client's response to the procedure. This serves as a means of communication and basis of care and evaluation of patient's outcome. Lastly is perform hand hygiene.